Okay, we're going to talk a little bit about hematology and some of the different disease processes that go with that. So, I would recommend that you know your normal values of some of the basic hematological labs. For example, normal hematocrit for male and female, your hemoglobin, your platelet count, your WBCs. These are something that'll come up all the time in lab when you do clinicals. So just be aware to know those, and we'll be talking more about those as they come up. So erythropoiesis, that is the whole process of forming red blood cells. And there's a lot of components that go into red blood cell maturation and growth. You have to have vitamin B12, you have to have folic acid, iron is needed for the hemoglobin synthesis, big factor, vitamin B6, amino acids, vitamin C. Notice vitamin C converts folic acid to its active form, so it also is part of the erythropoiesis. So all of these things are important for hematology and things like that. So anemia. First thing we're going to talk about is anemia. Anemia is basically just a deficiency of erythrocytes. Or hemoglobin, or the volume of the packed red blood. So if somebody is anemic, it could mean that they've lost red blood cells because they're not growing enough. They've got something wrong in the bone marrow where the cells grow. They could be bleeding somewhere. They're not taking enough iron. All these things could be the cause of the anemia. So when you think anemia, if someone says, well, I'm anemic, it doesn't mean they've been bleeding. It could be they have an upper GI bleed or a lower GI bleed, or it could be they're low in iron. Think about of the other things on the other slide. Maybe they're not getting enough B12. Maybe they're not getting any folic acid in their diet. Maybe B6. All these different things could be caused, or it could be something happening in the bone marrow. So lab results for anemia. Notice we have them listed as mild, moderate, and severe. Severe is obviously hemoglobin less than 6. Mild is 10 to 14. As I showed you last week, we used to give a lot of blood. We don't give it near as much. So I've seen patients that go home with a hemoglobin of 7. We didn't give them any blood. If they're actively bleeding and it's going down, that would be a cause to give blood, because as the blood's going out, it's going to get lower. But if they just had a loss of blood from surgery, and that's normal a little bit, then they know they're not actively bleeding. It'll come back. It just takes some time. Maybe patients under 6 would get some blood, but I've seen patients with 6 and they're still not getting blood. Also remember, in your labs, if your hematocrit goes down, your hemoglobin goes down, or if your hemoglobin goes down, your hematocrit goes down. So they work well. Both will go down and both will go up depending what's going on. So first one we're going to talk about is iron deficiency anemia. This is the most common anemia. This is the one where people are not taking in enough iron. As you remember, iron is absorbed in the duodenum. It's best to absorb iron on an acidic base. So taking iron first thing in the morning, or taking it with some orange juice, will help absorb the iron, because then it's in an acidic solution. So if someone is iron deficient, they will have a decrease of their hematocrit and their hemoglobin. So if somebody is bleeding and that's the cause of their iron deficiency because they have blood loss, as you recall from previous courses, if you're bleeding in the upper GI, And when that blood works its all the way down to the large intestine, then they have black stools, which is called melena. It doesn't take very much, 50 to 75 milliliters to have black stool. That's not very much. If somebody vomits blood, and it's frank blood, meaning bright red, it's an active bleed. So tests that we can do for bleeding, melena, a guaiac stool, we could do an endoscopy or a colonoscopy that will look to find the active bleeding. So bone marrow, if we have something going on and we want to find out in the bone marrow what's causing the anemia, how is the bone marrow test done? Have you seen a bone marrow test? So hopefully if we fix the problem, we will be able to bring the anemic or stop the anemia. So let's treat the underlying disease, otherwise it's going to continue unabated. So treatment of the iron deficiency, let's fix the bleed. We can administer iron supplements. Iron can come in oral, parenteral, or there's iron in packed red blood cells just by giving someone blood. If you're taking an oral medication, make sure it's ferrous sulfate and it contains elemental iron. If you've actually purchased iron to take, it usually says it's 325 milligrams / 65, which means 65 milligrams of the 325 tablet is ferrous sulfate, or it's the elemental piece. So really you're taking a 325 tablet, but you're only going to get 65 milligrams of iron. Side effects of iron or taking oral iron, some people say it causes constipation. If you take it on an empty stomach, some people will say it causes nausea. So you have to be aware of teaching a patient not to get constipated from taking the iron. So we can also give iron IM. That's iron dextran. That's the way, if we give it IM, it's in a Z-track method. Z-track is for staining and better absorption. If we're given it IM, then it's going to be in the IV. So another one of anemia is called thalassemia. Thalassemia is a recessive genetic disorder for anemia. It's usually ethnic groups of Mediterranean area and equatorial regions. These patients have a very short lifespan. They just do not make enough hemoglobin. Therefore, they are very anemic. Think what would happen if you're really anemic. You're not going to have enough oxygen. You're going to always be tired after so much time. If you don't have enough oxygen getting to all your body systems, then they would be starving for oxygen. So there's lots of damage. So I have never seen this. I've never met somebody that has thalassemia. Just be aware of it. Another one we're going to talk about is cobalamin deficiency. Another word for cobalamin deficiency is vitamin B12. So in your stomach there are cells called parietal cells, and these parietal cells produce what's called intrinsic factor, the IF. You have to have the intrinsic factor to absorb vitamin B12, also called cobalamin. So if you don't have, or you're not producing enough intrinsic factor, or you're low in vitamin B12, they call this pernicious anemia. This is the most common type of the megaloblastic anemias. All you have to do is remember cobalamin. You don't need to remember megaloblastic. So these patients, usually they don't have any IF factor. So it can be genetically common in Scandinavians, African Americans. So these parietal cells, though, in your stomach, if a patient has gastric bypass surgery, or if they happen to have a gastrectomy because of ulcers, depending where they cut, the patient could lose the parietal cells that secrete the intrinsic factor. So that would be something that would be causing the pernicious anemia. It could be somebody could have pernicious anemia because they just don't take enough vitamin B12, or it could be because they've got these cells removed. So treatment for pernicious anemia, well, we need to give them vitamin B12. It could be given IM. If it's an emergency, it needs to be given on board. It could be given intranasally, or someone could take it through diet and PO as well. If someone has pernicious anemia, they are hypoxic because they're not getting enough oxygen. They could be anorexic, nausea and vomiting. And here's the key for patients that have pernicious anemia. They have weakness and paresthesia in their extremities. This is the only one of the anemias that you have the weakness and paresthesias. So once you get enough vitamin B12 on board, this will go away and you won't have that. So insidious onset. Insidious means it comes on very, very, very slowly. You just don't get this overnight. It goes on very slowly. The patient doesn't know what's going on until all of a sudden, wow, I've got this weakness, a paresthesia, I don't feel like eating, I'm short of breath, and then they basically figure out what's going on with the patient.